welcome to Instagram Live.
Thank you so much on this crazy night.
Yes, it's a little bit of crazy weather. Yes, indeed. So let me introduce you. My name is Melissa Jacobs. This is Mainline Tonight. My guest is Kelly Andress. She is the CEO of SageLife. She is a lady boss. And SageLife is senior living community, 55 and older. They have a lot of different properties in the tri-state area. We're going to talk about that. We're going to talk about the impact of COVID-19. But I want to say that this is a positive story because I know that what you're thinking. You're thinking, oh, it's older people. It's about COVID-19. I know that's been devastating. You don't want to hear any more bad news about the world. I promise you, this is a good story. Believe me. Let's get to it. Kelly Andress, thank you so much for being on the show. I really appreciate your time.
Thank you. I'm so happy to be here.
Great. So let's acknowledge that COVID-19 has hit the 55 and older and 80 and older populations very hard. There have been thousands and thousands of deaths because of comorbidities, fragile immune systems, and a whole host of other issues. But let's give people the scope of what SageLife is. So describe how many people you have living in your properties and where they are in the country.
So we have three, we operate in Pennsylvania and in the greater Baltimore, Maryland area. We have 4 properties in this area. We have Dalesford Crossing, Echo Lake, Kiffin Grove, Chestnut Ridge, Plush Mills. And so we have 650 seniors living with us, and we offer independent assisted living and memory care services in our communities.
So that's 655 seniors, and they're 55 and older, but sometimes much older, correct?
Oh, correct. Our average age is probably 75 or a little higher.
Okay. And how many employees do you have? You call them associates, I think, right?
Yes. We're proud to be to manage about 600 associates in all the states, and they range from caregivers to dining personnel to activity associates, the whole gamut.
So you had, let's say, 1,250 people either working for you or living in your communities when the COVID-19 pandemic hit. How many deaths did you have from COVID-19?
Well, we have had, since March 15th when they started testing, we've tested a total of 15 residents, and 9 associates have tested positive for COVID. So our original strategy was to, hunker down, provide everybody with the PPE they needed, and conquer this. We've kind of assumed the Under Armour protect this.
Well, we're going to get into a strategy in a second. I just want to tell people how amazing these numbers are to show them that your strategy worked before we explain it. So it's 24 people tested positive, but how many deaths were there?
So far we've had 4 deaths from people who have tested positive. So we're very sad to lose those residents. We are one big family, but relative to the numbers that you might be hearing, that's a relatively few given our large population.
So you have 650 seniors in 3 states, correct?
Well, we currently have operating communities in 2 states. The others are not yet open.
Okay, so you have 650 seniors in 2 states, and that has been one of the most vulnerable populations in this pandemic. And despite that, you've had 4 deaths, which, while that is tragic, it is an incredibly low number. And to have only 24 people test positive for COVID is also an incredibly low number. So let's walk through how you did this. When I interviewed you for the story that has yet to come out, I was so surprised that the numbers were so low. And I said, how did you do that? And you said, well, we had a plan. So, so you had a plan in place for other sorts of disasters. So explain the plan.
Right. So our plan, we start with natural disaster plans. We start with plans for tornadoes. We start for plans for, fires. We have all these different disaster plans that we start with. And so what we did then was took all of those plans and adapted them for a longer term pandemic, which we really see this as a marathon. We knew going in it was a marathon. So originally, the first thing we did as we were preparing to hunker down was our plan was to purchase a lot of PPE. We purchased, I think, across our community about $100,000 worth of PPE to have in our stores to be able to deploy out to our community should they need that.
And do you remember when you started doing that? Because I would
say like February, March is we first really started hearing about it. But we see that one of our responsibilities to be the employer of choice in our industry is to provide our associates with the equipment that they need to do their jobs well. So
you started buying PPE and you could get your hands on it at that point.
Yeah, we took some risks. We bought some from China. We started aggregating from all different sources, created an inventory system so that all of our communities are tracking their PPE when they need to be, so we can track when they need to be replenished. And from the get-go, if any of our residents or associates wanted a mask or gloves, we were able to provide them for them.
Okay, what was the next step?
So then it was just policies and procedures. And we were laughing earlier. It was a lot of the same things that we did in our family life, right? We kind of hunkered down. We thought out what our schedules would be like, and then we realized after a couple weeks, well, those need to be changed. I'm sure that happened in your own family. There was this big push for technology. Do our residents have...
Well, hang on. So you said to me before that this has happened. You have had noroviruses. You've had, other sorts of contagious viruses that you have to contain. So you said this is... that you used that template, but you just beefed it up like 100-fold, right?
Correct. So any senior living community has to have plans for if there's a particularly virulent normal flu for the season. The easiest way to contain that is to lock down for a very short period of time, so that until it runs its course through the community, and you can minimize, who gets it. And it's a lot like when you have children in your schools, right? You take your children out of school and don't come back until you don't have a fever for 3 days, right? So what we did was we started from that, and then we realized, well, this could be weeks. But
you did have a lockdown. You did have residents in their apartments, right, and in their homes.
Yes.
And there were rules in the beginning about they could not come out.
Correct. Well, we sheltered in place just like everybody else did. And so during that time, it was still cold. I mean, we had such a cold March that was just awful. And so we had such a cold March. So we really did. There was a lot of time that our residents spent inside their aparpants.
And we did a lot of work about how
exercise in the hallway and things like that. So
you had to deal with meal delivery and getting other things in and out of their apartments for them. How did you deal with that?
So we have a very large dining staff in each of our communities. So we normally have anytime dining where you can come down in our cafes or our restaurants. So we had to completely convert that to room service. So we're doing room service 3 times a day. We really pride ourselves on our residents being able to order whatever they want to order whenever they want to order it. But in order to handle this process of 3 times a day, everybody in their apartments, we really did have to, go to an ordering system where you order, and then that's what is delivered to your apartment. Our servers became deliverers. It was just, we'll figure it out, and we did.
And you had some people who have a spouse or they live with somebody, but a lot are alone. So how did you care for them and maybe their mental health?
Well, that was always a big concern of ours. So we kind of did what many people did with their parents. That's what I mean about the first real push for technologies. We had to be sure everybody, all of our staff that was helping with communication had large screen iPads, for instance. So our residents could contact their families and see each other like we're seeing each other here. And then we have personal visits. We have pets that visit. We have people that are in and out of our residents' apartments, throughout the day. Some people didn't want anybody to come into their apartment. Some people were fine just to have the meal delivery. Of course, we did the wellness checks, the temperatures, and the symptom tracking. But others were really more interested in more social interaction.
Yeah, you said there was a big technology jump. Like your staff helped people figure out how to use FaceTime and how to use all of these other apps that we all figured out too. But that they got it. They got the swing of it, and they got to using these communication devices, right?
Correct. And our residents, most everybody has a cell phone. So they started out at a much higher level than probably people would think they would. But things like Instagram Live, this is my first time on this. We're all learning new, and luckily at SageLife, there's lots of folks around to help them. Help them.
Okay, so then you started to segue, right, into like hallway activities and those sorts of things.
Oh, yes. So we have done, we've done things in the hallway we never thought we would do. We've had fashion shows. We always have a spring fashion show in one of our communities. So we had spring fashion shows, and apparently one of the highlights was the maintenance director describing the clothes, because we had to do it on each floor. So, you divide everything up by floor. We have, of course, our seniors I always say our seniors are so much like the rest of the population. They really look forward to happy hour. So we have hallway happy hour. Why do you miss happy hour? It's not just the glass of wine, but it's your chance to see your friends, catch up on with your friends and family. So we have hallway,
So what did they do? Just open their front doors and sit right outside their doors? Or how did that work?
Well, one of the funny things we had to do was, buy TV trays so that you could sit. You remember our old TV trays from the 70s, so that they could sit outside in the hallways and do activities and have drinks
but be distant.
But still be distant.
Yeah, be physically distant. Yeah, it's amazing. So what phase are you in now with this?
What phase are we in now?
Actually, let me ask it two ways. What phase have you been in for the past few weeks? Because we're about to go in Pennsylvania, in this part of Pennsylvania, we're about to go into the yellow phase on June 5th. So I want to know what that is going to mean, if anything. But tell me what it's been like the past few weeks.
Well, of course, in our business, Mother's Day is a big day. So we really made a push around Mother's Day to be sure that people could come and visit. And maybe it's because I'm a mother, but, Mother's Day we were not going to let our residents not see their families. So, and also we were just realizing we were in the 13th mile of a 26-mile marathon. So we had started to bring in, by that point, the screens so visitors could come in. You can come in and see your family. You can see your friends. We had begun.
So you're not talking about technology screens. You're talking about,
right.
Yeah, screens to protect their faces.
We call them sneeze guards, I guess. The large,
like plexiglass. Is that what they were?
Large plexiglass screens, so that you can come in and see your loved one. Some of our communities have very natural screens, like patio rooms with glass between them. So we were really focusing in May on opening up so that we could so that our families and our loved ones could see each other. So
But I'm sure
now,
everybody was screened before they walked in, right?
yes. Oh, of course.
And you had been continuously screening your employees as well.
Oh, yes. Everybody had done the temperature checks and the symptom screening. And it was easier then because everybody was sheltering in place. When everybody went home, they were sheltering in place too. So we have been opening up gradually over May, and now the world is opening up. So this is a new phase for us because our residents remain vulnerable. And so where we are now is we're in a big push for universal testing because we believe that testing is what is going to keep us safe. Because we will test positive before we will have symptoms. So, back to our Under Armour protect this house mentality. Protecting the house means allowing our residents to have a fulfilled life and to see their families, but also to be as proactive as possible at testing so that we can we can identify asymptomatic people when associates and residents, but mostly associates because associates are still most out in the world.
Right. So you said, if one of your employees goes home and her boyfriend or her husband or her kids or whoever has gone out because we're going to be in the yellow phase and they've gone to a store, they've gone whatever, and then they bring that home, that employee or that associate, as you call it, is then, going to be around somebody who could have been exposed to something. So that is going to have to raise your surveillance of employees as the people they live with go back into the world.
Yes, and we started our universal testing, and as of this month, as of today, we have tested about 160 people. We have 80 back from associates and residents, and everybody's clear. So we are going to be testing at this level daily for a very long time. But we really see it as the only way to keep us safe.
Yeah. Do you have a date or a projected date about when all of the services and facilities will be open at your different properties?
I don't know when our doors will be open. I don't think the entire world knows when any communal setting will be 100% open. But I do see us opening up. We're already opening up more dining, with spacing, certainly more family visits. I just can't look at my residents much longer and say to them, you can't hug your grandkid.
Yeah.
So our goal is to get everybody, to be able to see and be near their, be near their.
But at the same time, and let me just reintroduce you for people who are just joining us. You are Kelly Andress, the CEO of SageLife, a network of senior living facilities throughout the area. And again, these numbers are just astonishing that you have 650 seniors in your care and only 4 deaths, which, while tragic to lose anyone to this disease, that is an astonishingly low number. And I'm sure you're worried that, the more life opens up, that those numbers might go up.
Yes, we are, we live with it every day. It's what we think about 24 hours a day. Our residents, though, are they're proactive in their own care. Just like the rest of us, they will decide to take various risks for themselves.
You said something to me that was
they want to be.
You said something to me that was really interesting because among the 650 seniors who are in your care, there are baby boomers and then people who are 80 and over. And you said that there's been a big difference in the reaction to COVID-19 and the stay at home between the boomers and the silent generation. Mm-hmm. So what can you talk about that?
Well, our silent generation residents, the generation between the baby boomers and the greatest generation, they're our population that is generally 80 and over right now. They are a little more compliant about rules. They grew up hearing about the the Great Depression, and they have experienced war and sacrifice. So they have a very different sense of communal value and protecting and self-sacrifice, perhaps, for the good of the community. Baby boomers, on the other hand, are not known for that. And so they're a little less patient. They're a little less compliant. So you have to work with every individual you have. But, and our populations are just like the populations at large. We have compliant folks. We have people that want to burn the doors down. We have people that want to be introverts. We have people that are looking for happy hour every night. So we are definitely, we have 650 souls and there is no average.
So I want to talk about some of the long-term changes that might come out of the COVID-19 crisis. So one of the things that you told me about is what may become a permanent reliance on telehealth for seniors. So talk about that a little bit.
Well, to date, in most states, there has been minimal Medicare reimbursement for telehealth. So it has been difficult to get doctors and systems to really invest in telehealth services. And for seniors in particular, telehealth is so much easier than having to go to doctors or having our doctors come to us. So I think we've all probably utilize telehealth to some extent, or we know someone who has used telehealth during this COVID experience. So we see that as a positive long term. We don't have to send people out to go to the doctor. For instance, when one of our residents may want to go to a specialist that isn't in-house, that may entail the adult child, the son or the daughter, getting out of work and going to the doctor with them. When in reality, most doctor's appointments are just wellness checks or check-ins, and we can do those via telehealth, especially at SageLife, where we generally have 24-hour nursing. There can be a nurse with them at all times to take the vitals and do all that and take the notes.
But the Medicare needs to change, right?
Yeah,
the reimbursement.
So that we see as a huge benefit.
Yeah.
The other benefit that we have that I see is the technology use among adult children in communicating with their parents. I think that we all felt, oh my gosh, I have to run out and see mom, 2 and 3 times a day. And I think now that we're a little more used to speaking through technology, that I think that there will be more communication between families than less, because it has become so much more fulfilling.
Is it the same?
No, it isn't. But I think that whereas before someone might not have said, oh, I just won't talk to mom today because I don't have time to stop by, I think now there'll be a higher reliance on, let's just do a FaceTime call. And so I think it'll increase communication.
Yeah. So check in more regularly, even if it's just over the FaceTime or whatever it is. So let's talk about if these things were done and you had such success with them, why is it that so many, and you're not a nursing home, we have to say, but why have other facilities had such high death rates? Part of it is because of insurance, right? And part of it is because of private pay. And you're not a Medicaid facility, right?
So I think generally COVID has brought out has brought to light a lot of long-standing inequities in healthcare and in society. We are not in highly urban areas. We are in suburbia. We are private pay apartments and independent and assisted living and memory care. So we don't, by and large, have shared accommodations. So everybody has their own apartment. So that is two really important and big reasons. There's always a bit of serendipity in it. We are part of it is that we are fortunate that our associates have taken such good care of themselves. They are such professionals, and they have really made it a point to be careful in their own personal lives so as we don't bring it into the community. The other reason is because I think it's because we have really focused on cleaning, and everybody now, we don't shake hands. So there's some systemic issues that are helping everyone. And, I'm wondering how long it will be before we shake hands again, without feeling a little weird about it. So on the one hand, I think, being proactive and the planning and the communication and the process and the scheduling and all of that was great. But I'm also I'm also willing to admit that there's a bit of luck of the Irish in it.
Well, I don't think so. I think that's called leadership. Mm-hmm. And it seems to me that at least the way you've explained it, and now you've explained it to me twice, you followed a logical plan. And you did your research and you followed the science and you made decisions. And there's been such a stunning lack of leadership on state and federal levels concerning seniors and their vulnerability with COVID-19 that if other places did what you did, we probably would not have had so many deaths because you didn't. So that's just the logic of it, right? So what do you think is next for you? Again, you had 650 seniors in your care, very, very vulnerable population, and only 4 deaths from COVID-19, which, while tragic, is an astonishingly low number. So now that you have this model that works, what is next for you?
Well, our model has to change. I think there are a lot of good providers out there, and there has been a very wide disparity of experience in this COVID, through this COVID marathon. So what we have to do is continue to bob and weave, because as the world opens up around us and we have there's more opportunity for the virus to come in through asymptomatic people, we have to change our processes now in order to ensure that our residents can be as open as possible and as safe as possible. So the first thing is that, nothing should be tweaked more than a successful plan. In order for it you can't be rigid about it. Because these are humans that are involved. So the human element always has to be there. And I applaud the professionals in our community because they are hit daily with situations that we've never been presented with before. We had a situation I heard about today where the air conditioner repairman had to come. So what do you do? It's like when so we PPE'd him up. And away he went to fix the air conditioner. So there's just this myriad number of inputs that we're receiving. So the important thing is I think that at SageLife, the number one rule is to do what's right. And so when you don't have any historical evidence upon which to build a strong answer, then you take all of the evidence you have and you you hire people with great common sense, who have the best interest of our residents at heart, and then you give them the freedom to do what's right. And so I think if anything, we have what we call the We Care values. It's, work as a team, commitment to the SageLife community, etc. But the E in We Care is exercise common sense. And so I think that any leader is honored to have a group of professionals, leadership in our communities that exercise common sense. And so I hope that our government leaders become flexible, stay robust, and change as the world is changing, and then exercise common sense and do what's right.
Wouldn't that be nice?
I have faith.
I have faith, but I think you set a great example of leadership for men and women, but particularly because you're a woman. It's just, I think you're a great lady boss, and I think this is an amazing story. So I just want to end with asking what your life has been like the past 2 months, and how have you dealt with this stress and the unknown and everybody depending on you? How have you dealt with that?
Well, like I said, the first is to share the responsibility with great leaders. And I would like to say that we are proud to have a diverse leadership group. And we think that diversity is what gives us strength. So I think it's very important to say that this week, in particular, that we are better because we have a diverse leadership group. So what do? I'm like everybody else. I have 2 kids that came home from college and are now set up. We're set up in home taking classes. I continue to come to work as essential workers. Our office has stayed open. So we haven't been competing with Wi-Fi at the Andress household so much. Just the college kids were. And much like my residents, I love happy hour at the end of the day. I get strength from the people who are around me. I stick to my, we've had a fairly consistent work life. We're working more hours. We're working more days. But what the heck else are we going to do? You go home and there's no place to go anyway. So it's been and when you have lemons, you make lemonade. And the lemonade in this for us is that we are thrilled to have our kids home with us. We look at it as snatching some extra months from our kids that we wouldn't have had.
Well, you've done an amazing job. You've saved lives of the people who depend on you and live in your communities. It's a great story of leadership and innovation and responding in real time. So I want to thank you, Kelly, for coming on Mainline tonight. It's been an honor having you here. Thank you for sharing your story, and we'll continue to follow what happens with SageLife. Thank you so much, and have a good rest of the evening.
Thank you so much, and be well.
You too. Bye-bye.